Thank you so much, Dr. Nangia, for joining me. As I said, Dr. Nangia is one of the most respected pulmonologists in the country. He is the chief of pulmonology at Cluster 1 of the healthcare hospitals, and he was very kind to speak with me earlier as well when we were speaking during the second wave. But he joins me now to speak about another issue that has been, in my mind, Dr. Nangia, the last few days. I mean, it was expected. You expect the wave is going, the pollution wave is going to come the way it comes, but it's like just with a stroke of brush, that those beautiful blue skies and that cleanliness that we saw despite the pandemic, they all just vanished. That advantage, the benefit,
Totally.
everything's gone, right?
Absolutely, I agree with you. When we consider last year around this time and now around the same time, the situation is totally different. So last year we were so happy that we're not getting any patients of asthma, COPDs, allergies, primarily because I think most of us were indoors, we were wearing masks, the skies were clearer. But this time around again, we are in the same situation where the number of cases of asthmas, allergies, COPDs, they've all started to rise again. And that's primarily attributable to air pollution outside. If you actually see in 2019, about 1.7 million deaths occurred in India, which are attributable to the poor air quality around us. And that is about a hopping 17% of the total deaths that occurred in that year. Similarly, about I think 980,000 infants lost their lives because of the poor air quality. So air pollution can have a huge impact on our lives, which we don't even realize. This impact could be, just by a short exposure or a longer exposure. Shorter exposure would result in something like watering from the eyes, cold, cough, stuffiness, sore throat. Whereas the long-term exposure to air pollution can result in, very critical kind of situation, starting from an effect which could happen when the baby is still in the womb, till in adulthood. There can be various implications of that.
So, I know that when the second wave was happening, you were, as a medical fraternity, was extremely frustrated with people not coming out and, coming out with their masks and, not taking the required precautions. This time around, what is your reaction when people go out and burst those crackers, knowing where, we are beyond the borderline? Actually, we've crossed that line.
So it's very sad and frustrating. That was the time when we were frustrated because we didn't have enough healthcare facilities. We were not able to admit patients. And at that time, we thought that, it is nobody's fault. It's God's will that something of this sort is happening. But this time around, I think it's more of man-made. Air pollution is definitely more, of course, there are environmental factors which are involved. But if we're actually to break down the various causes why the air pollution levels are going so high, there would be one, stubble burning as a primary cause. Second causes would be the traffic vehicular emissions, then some smoke from the factories, then the construction sites, people smoking themselves. Cigarette smoke also is a very important component of the air pollution. Please remember that. Cigarette, hookahs, shishas, BDs, all those contribute significantly. And then finally, the Diwali firecrackers. Amongst the firecrackers also, if you see 4 of them, the Phuljadi, the Ladi, the Charkhi, and the Anar, they sometimes emit 200 to 2000 times higher particulate matter as what is permitted by the WHO. So, these are the various factors that we need to take into consideration.
So, and those are pretty much the normal ones that I use. But, coming to what is it that you're anticipating now are you anticipating any kind of a surge, or do you think that there's going to be like Dr. Guleria said, there could be lethal repercussions for patients who've already got vulnerable lungs thanks to COVID?
Right. So there are 2 aspects to it. One is people who've already suffered COVID and now are going to land up in a problem because of post-COVID and exposure to the air pollution. And the second is the impact of air pollution on the number of cases of COVID-19 and the mortality associated with it. So, there are 2 different topics altogether that one could discuss actually. So, let's take the second topic first, that what is the impact of air pollution on COVID-19 per se? And why does it happen? This is something that we've seen in the past also, whether it was related to SARS infection earlier on in our lives, or when we talk about the 1907 pandemic, the influenza pandemic that occurred for the first time. Even then, it was realized that wherever there were areas of polluted air, where the air pollution levels were high, the number of cases were higher, and so was the mortality. Even now, this time around with COVID-19, what has been seen with studies across the globe, whether it is European countries, China, or America, in all these places, there are studies which have shown beyond doubt that short-term exposure resulted in increase in the number of cases, and long-term exposure resulted in higher mortality because of the COVID-19. So short-term exposure resulted in a spike in the cases whenever there are areas where the PM 2.5 particle size was higher or nitrogen dioxide levels were higher. In those cases, in those areas, the COVID-19 cases were significantly higher. In areas where there has been a long-term exposure to air pollution, where the air quality index has been poor over a long-term basis, say 6 months or longer, in those areas with every 1 micron per meter cube increase in the levels of PM 2.5 particles, the mortality rate increased by 8%. And again, I'm saying these are all global studies. This is not just a country-specific issue, but this has happened everywhere. But of course, in India, the levels are much higher than what you would expect in the United States or in the European countries. Much, much worse conditions we are living in currently.
So, would
So
you say
definitely with that kind of an implication, there would certainly be a higher number of COVID-19 cases because we're still not through with the pandemic. While we think that the pandemic is on the decline, but that is not so. In the one, we have to understand that this virus may become endemic to us. Second, that this virus may undergo mutation. Third is reinfections can always happen. People are known to have a reinfection after 5 to 6 months of the previous infection. Vaccinations only prevent you from a serious illness. Vaccinations don't prevent you from a mild or an asymptomatic stage. So keeping all this in mind, that one, we still have an ongoing pandemic. On the other hand, we have worsening of the air quality. I'm sure we are in for trouble. Now the question comes is that how does air quality impact the increase in the COVID-19 cases? So there are again certain plausible theories. One of them is that with a higher level of PM10, that means particulate matter 10 microns and higher, being suspended in the air, the virus, that also gets attached to these particles and remains suspended for a much longer time, thus increasing its transmissibility. Second plausible theory is that the environmental pollution itself results in a kind of an inflammation inside our lungs, resulting in a weak defense mechanism. So we automatically become vulnerable to an external agent. That could be COVID, that could be influenza, that could be any other virus for that matter. So we become more prone to respiratory tract infections just because there's an ongoing inflammation inside our lungs because of the environmental air pollution. And third theory is that long-term exposure could be resulting in worsening of the underlying status of your diabetes, heart disease, stroke, which again make you more vulnerable to developing complications because of COVID. So these are the various mechanisms that one can think of when you say that the COVID-19 cases are bound to rise whenever the air quality index is going to be higher.
Things were a little different, were they last year at this time, Dr. Nangia, do you think? Or is there something that you all learned from how it played out last year?
So if we are talking about the number of cases of asthma, COPDs and all, definitely we saw a number that had gone down as compared to the previous years. And that I would attribute to the fact that people were more disciplined, they were wearing their masks, they were staying indoors most of the time. The skies were certainly better than this as compared to what we are seeing now. So of course, Diwali, stubble burning, vehicular emissions, all of them have something or the other to contribute to worsening of the AQI levels in our city, in our country, especially the northern parts. And it's not just a problem of Delhi as such, Delhi NCR as such. It's a problem of the entire Indo-Gangetic belt, where you would see that the air quality index is very, very poor these days.
So there's a question saying, are there any precautions, that you can take? I was also going to ask you that what is it that people can actually look out for in terms of symptoms that, that cocktail is happening between pollution and their lungs?
Right. So I think the most common symptoms would be starting with running of the nose, cold, stuffiness in the nose, sore throat, watering from the eyes. These are the minor symptoms. Then it could develop into a cough. If you go lower down, it could also result in allergies, fever. You could develop body aches. So those are all symptoms which overlap with a COVID illness as well. So the first and foremost thing that you need to do is at the first onset of the symptom, you need to isolate yourself. Not just attribute it to respiratory allergy, not just attribute it to a seasonal allergy, not just attribute it to your usual asthma issue or cold and cough issue that you have it around this time of the year, but isolate yourself. What is happening in the last week, 10 days, what I'm seeing is people are having this cough, cold, and they're attributing it to their respiratory allergies, their inherent problems, and not even considering the possibility of COVID there. Oh, this is something that I've had it always, doc. What I'm telling them is that, okay, you may have had it in the past also, but one, there is no harm in isolating yourself, because even if it is a simple influenza infection, why spread it to the others? You may be having a good immune system to be able to counter this infection, and where it may just be a mild symptom or a usual symptom for you, but for somebody else who's immunocompromised, who's elderly, who's suffering from diseases like diabetes, heart disease, stroke, even an influenza infection can be fatal. So why spread it to others? Why spread to the elders of your house? Keep it to yourself, even if it is. So stay isolated, first of all. Get yourself tested on the second day or the third day so that you're sure this is not COVID. Now we have this newer therapy that is available to us, which is to be given to a certain segment of the high risk people, depending on the indications, which has to be given within the first 5 to 7 days of the onset of illness. So why delay a diagnosis? Keep deferring it till the 7th day or the 8th day when your symptoms are not settling. You've already lost half the battle by then. So what I would suggest is stay isolated, get yourself tested. Come out of that sense of denial that you cannot have COVID. There is still that the factor of invincibility that is existing in some people who feel, oh, we are Indians and we can't be affected by COVID. Well, let me tell them all that anybody can be affected by COVID, however strong your immune system may be. Again, it may be a mild illness or an asymptomatic illness if you have a good immune response, a robust immune response, but you may spread it to others in the house who may not have as good an immune response. I'm sure you wouldn't want to be responsible for their deaths or their illness or their hospitalization. So that is the first thing that you should do.
Sorry.
Second is that continue following the COVID appropriate behavior. That would include wearing a mask. Double masking, I feel, is always a better strategy. That just in case one mask is ill-fitting, the other mask will take cover. Keep your hands clean. Use sanitizers at all times. Maintain a safe distance. Traveling should be minimal. Traveling should only be for essential purposes where it's unavoidable. There is no need to be just, going around partying. Even I understand that there's been a total fatigue as far as COVID behavior is concerned. So you could have a small gathering, 5, 10, 15 people probably, and preferably in area which is better ventilated, like open areas may just be a good idea, where you're able to maintain a distance also, and yet be together with your friends. And of course, at times when you're not eating, then you could be continuing to wear your masks. When you're eating, try and stagger your timing of eating. Like 2 people eat together, then another 2, then another 2, rather than everybody eating at the same time, crowding around the dining table. And ensure that all those people that you're meeting, 1, don't have any symptoms, 2, that they have been vaccinated. So vaccines become very, very essential in this state. People who haven't taken their vaccine yet, I think it's high time they woke up to it and took the vaccine tomorrow itself. Vaccines are the only hope that we have as far as protection against this COVID-19 is concerned.
I'm glad you
Whatever
said
the efficacy may be, 60%, 70%, 80% doesn't matter. But those are the best shots that we have with us right now. And we should go ahead and take the vaccination without worrying about any side effects. Minor side effects happen with even simple medicines, but major side effects are unknown to happen with the vaccine.
No, I'm glad you said it again. I think it's very crucial. I think it's the only way for us to exit this. But tell me something, doctor. Does this kind of pollution make people who've already had COVID a little bit more vulnerable? Does it make them more vulnerable to a relapse?
Right. So, again, it's the same thing as I've already said, that COVID-19, so the air pollution results in a kind of an inflammation in the lungs. COVID-19 also follows a similar inflammatory cascade. So if you've had COVID-19, there would be two sets of patients. One would be those who have developed a long-term sequelae in their lungs because of COVID illness in the past, like lung fibrosis or lung inflammation. They would definitely be more prone to developing the same infection again because their lung immune response is compromised because of the damage done to the lungs because of the past COVID infection. So you have a kind of a nidus that is available to you, like a hotbed that is available to you. On top of that, the air pollution would worsen the lung functions further. And then COVID becomes, I wouldn't call it a cherry on the cake, but yes, it would definitely precipitate a huge kind of a volcano kind of an eruption inside the body once that happens.
So what kind of complications can arise now? Could it be anything different than what you have seen over the last few months?
No, the four most common complications that we see related to the lungs per se, I'm not talking about the systemic complications of COVID and the long-term sequelae of COVID. The four most common complications are one, of course, lung fibrosis. People who've had COVID in the past resulting in some kind of a lung damage may progress towards lung fibrosis because of air pollution. Also, certain inflammatory cascades get triggered in the lungs, which could further enhance or speed up the process of progression towards fibrosis. Second is development of clots in the lungs, which is not related to air pollution per se. Third is development of air leaks, which is called a spontaneous pneumothorax in patients with COVID-19, again, which is not related to air pollution per se. But the fourth thing, that is a secondary infection. The secondary infection because of TB, fungus, bacteria, viruses, those all would definitely increase in the presence of air pollution and COVID-19 put together.
So there was a question asking you what kind of advice would you give somebody who's asthmatic?
Right. So before I go on to that, a couple of other things that I got left behind was that cardiovascular complications would also be higher because COVID also results in cardiovascular complications, and so would stroke be higher in these patients where you have a combination of air pollution and COVID-19. So now coming on to your question about what advice I would give to asthmatic patients. So one, asthma patients need to remember is that when the air quality index is so poor, they should not be moving out at all. Strenuous physical activity is totally banned during this period outdoors. Whatever exercise you have to do, you should do it in a properly ventilated room indoors. If at all you have to move out, then you have to be following the standard COVID-19 norms of wearing your mask, keeping your hands clean, hand sanitizers, maintaining distance. Apart from that, what is very important is that you must be using your inhaler therapy regularly. The medication that has been prescribed to you by your healthcare provider, that should be used regularly. There are two types of therapies that are available for asthma patients. One is the controller therapy and the other is the reliever therapy. Controller therapy is a medication that is given on a long-term basis to keep the symptoms and the inflammation inside the lungs under control. So controller therapy is something that they should be using on a regular basis. Inhalers is the best form of delivering medication for asthma patients. Lots of patients ask me that I hope doc will not get addicted to the inhaler My simple answer to them is that you have to understand what are the advantages of using an inhaler. First of all, inhaler is the dosages are in micrograms as compared to if I was to give you a tablet of the same medication, it would be in milligrams. So it is 1 millionth the dose that one is giving you. Second, that they are locally acting inside the lungs. When you take the inhaler, it goes directly into the lungs and impacts and affects the area where it is supposed to act. Otherwise, if I was to give you a tablet, syrup, or an injection, it would first go into your stomach from where it will get absorbed, circulate in the body, and then reach the lungs. So, causing so many side effects on its way. So, the side effects because of the inhalers are much, much lesser. You have to consider the fact that inhaler is just like it's a modality of delivering a medication. Like you have tablets, syrups, injections, so are inhalers. So there's no big deal about it, really. It is very important for all asthma patients to be keeping their asthma under control and by use of controller medication.
Before I come to you about the critical question of the elderly and the children, there's another question asking you whether people who've got COVID earlier should be constantly getting their lungs tested, especially in these times? Or is it okay if doctors say the recovery's been good?
So basically, again, it is all symptom based. There are no specific medications unless there are symptoms. Even if there is some scar, so many people come and get their CT scans done for the lungs to see what damage has been done to the lungs. But CT scan may show some scars for which there is no treatment. So it really doesn't help. If you have symptoms, then you should not ignore it. Then you should contact your healthcare provider and seek treatment for it. Symptoms would be in terms of persistent cough, breathlessness, chest pain, fever off and on. So these are the symptoms that you need to keep in mind. And if you have those symptoms, then preferably go to a doctor and consult. Otherwise, there is no need. You could probably do a 6 minutes walk test and see if there's any drop in oxygen levels when you're walking. So it's a simple test where you're expected to walk for 6 minutes at a normal pace and check the oxygen level before, during, and after. If there's a drop in oxygen level of more than 3%, then again you need to consult your healthcare provider.
So I'm coming to the issue of children. Those to me are extremely vulnerable, not vaccinated. Schools have opened. Pollution has already made them very vulnerable over the years. What would you tell parents at this point?
So as far as children is concerned, one is that it's lucky for us that so far children have only had a mild disease and not many children have been affected. But that doesn't mean that, in future it can't be. Even children can get affected. There's a whole syndrome which is called the multi-organ involvement syndrome in children, the MISA, which is known to occur and can be life-threatening also. So I think we will have to watch the situation in the next couple of weeks, how it remains. Is it only impacting the adults again or not? I'm sure there's a lot of query in the minds of people about the schools now that the schools have opened. You just have to ensure that adequate precautions are being carried out in the school. COVID appropriate behavior is being followed. The staff members are properly vaccinated and they have their vaccine certificates with them. Interaction between children is concerned, again, they should be preferably at a distance. 5-year plus child can always wear a mask. So that should not be a problem. And I'm sure very soon we'll have vaccinations for children as well. A vaccination, Pfizer vaccine has already been approved in the US for children.
Yeah, the 5 to 11. Are you in favor of? Yeah. It's a very personally, I'm saying from my own point of view. It's a little confusing whether you give a child so young a vaccine or not. What is your take on that?
So Jyotsna, if vaccine has suddenly become a point of discussion only after COVID. Prior to that, children were undergoing vaccinations left, right, and center. The day the child is born, he receives the first vaccine in terms of BCG and hepatitis B. And then there's a series of vaccinations. In fact, the first 5 years are spent taking rounds of a pediatric OPD or a pediatrician only for the vaccinations. So I don't see there's any reason that we should give it another thought. If we know that the only tool in our armamentarium against COVID is vaccine, then I think children should also get the vaccine.
Yeah, you spoke exactly what my mother told me. So, yes, I would tend to agree. But the thing I wanted to ask you, in the recent years, have you been seeing an increase in asthma in children as well? I've been
Oh,
hearing
that's
it's not
very interesting.
for me.
That's really very interesting. I wouldn't know the exact statistics now, but there was this very interesting study that was conducted recently where they actually compared the number of cases of asthma in children studying in Delhi and asthma in children studying in some two cities of South India, where the air pollution levels were certainly lower than the air pollution levels that we encounter here in Delhi. And there was a significant difference in the number of cases that was seen in Delhi as compared to South India, where it was a much cleaner air. So it goes without saying that because of the air pollution, the number of cases, especially in children, is on the rise. There was, in fact, another study also, which sometime back, which actually showed that amongst the adolescents, there was a 40% decline in their lung functions. Sorry, amongst 40% of the adolescents, there was a decline in the lung functions as compared to what it should have been as per a normal child.
Some of the statistics and reports and studies that come out are fairly scary.
Very, very scary. And believe me, but they are authentic studies. You know,
Yes.
this other study that I was quoting about earlier was a very authentic study done very, very in a very structured manner and very scientifically.
No, I agree, and it's a bit dismal. I mean, I don't see things changing. I would like to be hopeful, but every year it's the same story, to be honest. So, anyway, that's a different discussion. There's a question for you. How much exercise is within limits in these times?
Okay. So first of all, as I said, outdoor exercise should be banned completely. The question of morning walks, marathons does not arise at all. You know, there's no way that you could be going in for morning walks these days or going in for marathons. Marathons also happen around this time of the year, I know. So they have to be totally banned from happening. One is that. Second is exercise should be only as much as your body can tolerate. Don't push it beyond a certain limit. You know, it should be so. Even for COVID patients, it was said that you build up the exercise levels gradually and not start exercising on day one. And the maximum you should achieve is 80% of your maximum capacity is what you should be achieving and not beyond that. And that too has to be done in a graded fashion. You can't be right on day one starting to run a marathon, even indoors. It's not possible. So it has to be one graded. Second, only 80% of your maximum capacity. Of course, it would vary from an individual to individual. You know, somebody may be in the habit of walking 11 kilometers a day, another person may be in the habit of walking, say, 5 kilometers a day. But so you have to reduce it a little so that there's not much stress on the lungs. And also, please remember when you're exercising outdoors, what is a normal reaction? You know, normal reaction is that you start breathing faster when you exercise. So a normal respiratory rate I would consider as 14. When you're exercising or post-exercising, the respiratory rate goes up till 20-25. The volume of the breath is also larger than the deep breathing increases. So, you know, there's no rocket science in understanding that if you're breathing 14 breaths in a minute, each breath is 500 ml. So that means about 14 into 500 is what? 500 plus 200, about 700 ml. I mean, whatever the calculations are, let's keep that aside. But if you're breathing at a rate of 20 and 25 per minute now, and the volume has increased from 500 to 600 ml or 700 ml, so there's a much larger quantum of the polluted air that is going inside your lungs and from the lungs into your circulatory system and reaching the various parts of the body and harming you. That is why I'm repeatedly saying exercising outdoors should be banned completely at this stage.
And you know, a lot of parents actually send the children out saying that they need some they need some fresh air, and I find that a little bit worrying.
Yeah, this would be a wrong time to be sending the children out.
Yes, absolutely. So, you know, just going to end it here, Dr. Nangia, but your final words on the fact that prevention is always better than cure. What would you tell the people of the National Capital Region at this point?
So, as I said that in the beginning also, that the first thing that you should do is at the onset of the first symptom, isolate yourself, get yourself tested for COVID-19. Don't just consider it a simple flu. Even if it ultimately turns out to be a simple flu, you haven't lost anything by isolating yourselves and getting yourselves tested for COVID. Follow COVID appropriate behavior at all times. Make mask a regular feature of your attire. There, all these designer fancy masks that are available. Probably you could use it as a style statement also now. And vaccinate, vaccinate, vaccinate. Anybody and everybody who's eligible for the vaccination and has not taken the vaccine yet should go and do that tomorrow morning itself.
Thank you, Dr. Nangia. I don't think there's anything left to say. Vaccinate, vaccinate, vaccinate. I did get my second shot just a few hours ago. So I can say, please go ahead and do it. But thank you so much, Dr. Nangia, for taking the time out today to speak with me. And I hope that, I will be circulating this out for other people who've not been able to see it so that they can get the benefit of your the wonderful information that you've shared with us today. Thank you so much for joining me, and I will be in touch with you. I'm sure I will be calling you back and pestering you to come back on this session very soon. Thank you so much, Dr.
Sure, and thank you so much, Jyotsna. I hope it was useful and useful to our viewers also.
Absolutely. It was absolutely. Thank you so much.